Morning, everybody. Once again, Dr. Salim is here with you guys. Let's practice some more registry exam questions from ARDMS or especially for SPI. And let's discuss some more questions which will help us to pass or to clear our ARDMS, especially that SPI exam, on the first attempt. Okay, let me share the screen with you guys. Okay, here are the questions. So the question is, you can see here that unchanged temporal resolution, unchanged pixel numbers, unchanged spatial resolution, and post-processing are related to which of the following? Right magnification, read magnification, both, or none of them? What do you think? Correct. It will be a read magnification. Absolutely correct. Okay. Next, with which of the following processes frame rate change? Just, we're not saying the frame rate increase or decrease, but change. What do you think? Exactly correct. With the right magnification, because it has to be in the real time. Okay. What will happen to the frame rate if we increase the line density of the sound beam? You know, you have less line density. Now, if you increase, you can make it more line density in a picture. What happened to the frame rate? What do you think? Absolutely, you will be more load on the machine, and the answer will be the frame rate will decrease. That is absolutely correct. Okay, next question. Okay, what happens to temporal resolution when frame rate increase? This question is basically asking for the relationship between the temporal resolution and frame rate. Like, what are their relationship? Exactly, a frame rate increases, temporal resolution will increase as well. So they have a direct relationship. Correct. Okay. What happens to the frame rate when spatial resolution is inferior or degraded? What do you think? Yes, it will increase because the machine is under less load. Machine is working less for you. Machine is happy. Okay, absolutely correct. Next question. Okay, so this question is, what happens to the frame rate if we decrease the depth? Very simple, the easiest question. If the depth is decreased, what happened to the frame rate? Exactly, it will increase. Absolutely correct answer. Okay. With shallow ultrasound or superficial scanning ultrasound imaging, the frame rate of the system get increased. Is this true or false? Yes, it is true. Correct. Because the machine will be easily scanning. If you decrease the depth, so now it's a lot easier for the machine to work very fast, and it will give you a lot of images per second instead of a deeper structure. Correct. Okay, all the following happens when we scan deeper structures, except. So look for the exception. Frame rate decrease. If you're scanning deeper structures, so frame rate decrease, longer T frame, temporal resolution decrease, or frame rate increase. What do you think? If you're scanning deeper, everything above is correct except D answer. This is wrong. So we can say that is exception. Because with the deeper structures, frame rate decreases, not increases. That is correct answer. Okay, next. When the number of pulses increase per scan line, what happens to the frame rate? If we increase the number of pulses per scan line. Exactly, they have indirect relationship. That will decrease, correct. Next, if we increase the number of focal points for ultrasound beam, so what happens to the frame rate? What do you think? Instead of having one focal point, if you make it 2, 3, 4, 5, 6, like multiple more. So if you increase the number of focal point for a beam, what happens for the frame rate? What will happen? Exactly, it will decrease, absolutely. So keep in mind, easy answer is when you give more work to the machine become tired, the machine is busy, it's more load on them. It will take some pictures from you. So frame rate is, the definition of frame rate is number of pictures per second. So it will give you less pictures per second, actually, in that case. Which of the following sector will give us a higher frame rate? Like, which of the following sector size, we can say wider or narrow, which one will give you more pictures per scan line, per second, sorry. So what do you think? Which one is the correct answer? That is correct. The smaller or the narrow, the width, we can say, the sector size is the narrower the sector size, more pictures. That will give you more frames, actually, increased frame. Okay, what is the relationship between temporal resolution and frame rate? Very simple question. Yes, correct. It has a direct relationship. Absolutely correct. Okay. Now let's do these few more questions. Okay, the question is, if propagation speed of the sound increase in a medium, what happens to the frame rate? What do you think? Or you can say, what is the relationship between them? I'm also agree. It will decrease, so they have indirect relationship. Correct. Next question. All the following have a direct relationship to temporal resolution except. So what is exception? Because there are 4 answers. 3 of them have a direct relationship to the temporal, but one is not. What do you think? Sorry, they have indirect relationship. One thing is direct relationship, but the 3 of them are indirect. Yes, frame rate. Frame rate is the correct answer. Frame rate has direct relationship with temporal resolution. Other 3, depth, number of pulses per scan line, and propagation speed, they have indirect relationship. Okay, next. It is asking for persistence is from which of the following process? Like when we click the button persistence, correct? When they average the frames. So what do you think? Is it pre-process or post-process? Or both? What do you think? Exactly. It has to be pre-processing. It is a pre-processing. Correct answer is pre-processing. Keep in mind. What is the relationship between frame rate and persistence? What do you think? What is the relationship between frame rate and persistence? I have to see that question also. I'm sorry. I don't want to give you the wrong answer. Yeah. What do you think? They have indirect relationship. Correct. Okay, next. Okay, so this question is asking for choose the correct level of persistence for rapid moving images. When you're scanning rapid moving structures, so what do you think? What is the persistence for them? Is it a low level persistence? Is it medium level, high level, or all of them is equal? What do you think? Exactly, it will be low level persistence because for the machine, it's a lot easy to average the frames when the structure is a solid structure, not movable, unmovable structure. That's easier for the machine. So if you're scanning some structures which are movable, fast movable, it's a little bit tough for the machine. So they will have a low level, they will have a slow persistence for them actually. Choose the best level of persistence for thyroid tissue imaging. What do you think? When you're scanning thyroid tissue, what do you think? What will be your persistent level? Exactly, it will be a high level because it's a not movable structure. It's just a solid structure and it's not moving. Okay, a high contrast image will have what type of dynamic range? What do you think? When you're looking for really brighter area is more brighter, darker area is more darker. So we can say a very high contrast image will have what range of dynamic range we can say? Is it a high dynamic, low, no relationship, all of the above? Absolutely correct. When you decrease dynamic range, because dynamic range goes by the percentage. If you decrease that percentage, the image will become very bright and very dark. So the low level echoes will be not in the picture. So B is the correct answer. This one, correct. Okay. Let's do the last question of this session. Okay. So it says dynamic range is a pre-processing method. Is this true or false? What do you think? It has to be in a real time. So is that pre-processing or post-processing? Exactly, it has to be pre-processed. It is true. So it has to be in a real time. Absolutely correct. Okay, thanks a lot for your support. So keep watching these videos. I'm sure it will help you on your knowledge. It will increase your level of your knowledge. And also, if you're a trainer, you can answer a lot of questions of your students. And also, if you're studying for your one of the national or international examination, I'm 100% sure you will clear your examination with the first attempt. Thanks a lot. And again, please don't forget to share the channel with all those healthcare providers or healthcare professionals who needs this type of information. But don't forget, tell them to subscribe the channel as well for the upcoming notification. Thanks a lot and see you next. Take care.